We are back with clinical psychologist Dr. David Gutterman from Cone Health, LeBauer Behavioral Medicine, talking about the impacts Helene could have on people mentally. So, doctor, what are some coping mechanisms we can use to help with these big life events, these big natural disasters we see?
Everyone's going to be a little bit different, right? There's no one particular type of coping mechanism, but I think all of us have to be able to manage our own experiences. So number one, it's very important to again recognize and not just repress your what your feelings are about what's going on. For many people, this is a traumatic event, depending upon their own histories, if they've had histories with different types of losses, and so. First, again, don't deny, how you're feeling. Talk with friends, talk with family about what's going on. We're getting a lot of input, a lot of data is coming at us, but it's important to be able to express, what your feelings are, what this is all meant to you as we continue to get more information and things unfold.
I would imagine that, for a lot of people, they see what's happened out west and they might almost feel a sense of guilt because it is happening to others, not the same way that it's happening to us. I mean, how do you process something like that?
Well, there are certainly feelings of guilt. It's almost like a survival guilt in the sense that the storm passed us and hit others. We are so used to some of this when we see these things happening on the coast. I think somehow the mountains is it's pretty unique to see this sort of thing. We've become almost accustomed when it comes to the coast, but it makes everyone also not just guilt but feel very vulnerable. And I think that's part of the most significant part of it is that everyone feels a little bit more vulnerable when you see these things happening. And what it does is it causes you to start thinking about, well, what if it were me? And what would I do? And how did people not escape? And do I have alternatives if something like that were to happen here?
Speaking of vulnerable, what would be a population of society that would be the most vulnerable to something like this?
As I was referring to a little bit earlier, that folks who've had significant losses, especially traumatic types of losses, be it through storms or accidents like that, uh, uh, especially if those losses have been relatively recent, within these last few years, because we're seeing so much grief and so much loss that that particular population is going to be especially vulnerable to having a traumatic response, which would mean things like anxiety, sleep disturbance, appetite disturbance, that sort of thing.
As adults, it's easier for us to process, what we see happening out west. But how do you talk to kids about a natural disaster like this and just the process that we're all going through to save people?
But it's a great question because you're exactly right. Kids will process things very differently, and we should not make the mistake of assuming they have the same level of understanding we do. So first and foremost, ask your kids, whatever age they are, whether they're teenagers, young adolescents or younger. Ask them what have they heard, what are they hearing at school, what are their friends saying. So get their understanding of it and what their feelings are about it before you launch into assuming you can understand whatever it is you believe that they're interpreting. So understand where they're at and then make sure that they do in fact have the facts at whatever age level is appropriate for them, because they're going to be seeing and hearing a lot about this because again it being so close to us. So they're going to see collections and all these things that are taking place, and they need to understand it. But what they also need to understand is again how we come together as a community, the resilience of people, the resilience of our community to come together and help each other out. So we want to focus on more of the positive than anything else.
Whether it's now or days or weeks down the line, what are some warning signs that somebody's mental health might really be, affected by this long term?
Well, I think it's important to recognize again for ourselves as well as our friends and family that very typical anxiety symptoms. So a sense of nervousness, especially related to things like storms. But the anxiety, you'll hear it in people's language and the way they talk in terms of their anxieties. If they are perseverating, meaning they're repeating over and over the same kinds of worries and concerns. You'll see some sleep disturbance, if someone's being re-traumatized from a recent loss that they've had, and then seeing all this devastation and loss, you might see them, slip into more social isolation, being a little bit, less verbal and pulling back from people. So you just want to look for signs that people's behavior is outside of the typical way they normally are reacting or carrying out their day.
All right, some important insight. Dr. Gutterman, thank you so much for your time. We do appreciate it. If you'd like to watch our conversation again, we're going to be posting it to the WFMY News 2 YouTube page coming up later this evening. Eric.